Via Skype from Cape Town is the head of MSF's Southern Africa Medical Unit. That's Doctors Without Borders, Dr. Tom Ellman. Doctor, thank you for being with us. Let's start with Madagascar. Is this problem right now contained in Madagascar itself? What is the situation there?
Yeah, so thanks very much. As you'll know, there's been a lot of talk in the press about spread beyond Madagascar, but so far there have not been any cases found outside the country. And I think we need to keep perspective while being cautious and watching out surveillance for it. The main problem is within Madagascar, and certainly the outbreak is ongoing there. And we're working on the east coast in Tomasina together with the Ministry of Health and other partners to try and contain this epidemic.
What are the chances that it can be contained, that it won't be spread? There is concern about flights from Madagascar. Is that fear real, especially because we're talking about something now that is airborne? Apparently that is how it's being transferred.
Well, it's not an airborne disease in the way that you can get it through air conditioning and things like that. It really is person-to-person spread. So what's exceptional about the epidemic this year, and remember that Madagascar has plague every year. There were well over 200 cases last year, over 60 deaths. What's exceptional this year is that the plague started early. We've had a very large number of cases, over 1,200. But what's really exceptional is the number of cases that are in the lungs, pneumonic plague. And pneumonic plague can be transmitted from person to person, but only really people who are in close proximity to somebody with the disease, so health workers looking after patients or family members. And we certainly can contain it, but we need to make sure that we get to people who are at risk to prevent the disease by giving antibiotics, and that we spread awareness around the disease so that people seek treatment early when they get it. But I should emphasize that this is currently only in Madagascar.
And there was some concern about a South African man who contracted it but was treated. Can you allay fears? Because so if you undergo the right treatment, you respond to the antibiotics, everything is fine. You are no longer contagious.
Absolutely. Treatment is very effective, simple antibiotic treatment, but what's important is that you get access to treatment early. So once you're treated, you're cured, and certainly the man you're talking about is cured, and there is no risk from people who've had the disease and been treated for it.
We saw pictures there of the countries on alert, basically all along the east coast of Africa, all the way down to South Africa, because of course Madagascar is in the sea off to the east. If it does arrive in this country, are we prepared? Are we geared up for something like this? How quickly could it possibly spread?
Well, I'm not best placed to answer that, and our focus is on responding to the epidemic where people are currently contracting it and indeed dying from it. So I think that others within South Africa are best placed to respond. Yeah. But all the evidence suggests that a well-managed surveillance system, watching out for the disease, finding people early, if indeed anyone does arrive with it, and of course for the week or so while people are incubating the disease before they get sick, people can get on an aeroplane. So inevitably that is a possibility. But I think it's a relatively low risk, and I think that awareness is now high. So it's up to the governments in the countries where the concern has been triggered to ensure that they're monitoring well. But certainly there is no reason to panic.
Sure, but at that point there would be learnings perhaps from Madagascar, scientists, doctors speaking to one another, health institutions. Looking at Madagascar itself, would you say this is being well managed overall right now?
Well, working together with the Ministry of Health in Madagascar and WHO, who have far greater expertise than we do, working together with them, we've really come in to help, to give a helping hand because of the unprecedented size of this outbreak. But I think that they are managing it currently well, and with the support of partners, I'm sure that this is going to be put under control.
My final question to you, maybe just explain how this is behaving. We hear of Europe in the Middle Ages, a third of the population wiped out, the Black Death. Just describe how more recent modern outbreaks have ebbed and flowed, what sort of death rates we see, how are we geared as society, as all countries, to deal with this plague in the modern era?
Well, we're certainly far better off than we were in the Middle Ages, when this was indeed a catastrophic disease. People didn't understand where it came from, and they didn't know how to treat it. Now we have very, very good understanding of the disease, and it cannot be eradicated completely because the disease lives in animal vectors and occasionally jumps across to people. So even in the United States, they have cases every year. Madagascar is one of the hotspots for the disease and copes with it with occasional outbreaks and people infected and occasionally dying every year. So we're not in any risk of this isn't a new disease, this isn't an unknown disease. It's something that is going to stay with us, and we know how to deal with it. So I think that there are questions around why the outbreak has been different this year, but I don't think there is any reason to believe that this is the sign of some fundamental change. We treat the disease with antibiotics. We need to be vigilant. People need to know about the disease when it is happening in their area so that they seek treatment early, and people who've come into contact with anyone with the disease can be effectively prevented from becoming sick by taking a course of antibiotics.
All right, thank you very much.
Which, of course, didn't exist in the Middle Ages.
Yeah, thank goodness for that. And thank you for your calm and rational explanation. That was Dr. Tom Ellman from Médecins Sans Frontières, Doctors Without Borders.